Ruggero De Paulis is very well known for some achievements in the field of research about cardiovascular pathology, particularly the aortic root. So my first question to him, would you mind telling us what and who mostly inspired you as an academic surgeon from a research point of view, and who inspired you mostly as a surgeon in your career?
Let's say my career in cardiac surgery started a little bit by chance, because when I was at the last year of my study in the medical university, I had an interest for cardiology, but also I didn't like, I like something to do with the hand. So I put together the two words without nothing about the cardiac surgery, actually. And then I decided to start this cardiac surgery, cardiothoracic surgery, just because I putting together the two names, and I looked through the country, a place where I could do it, my residency, and I found a place up in the north of Italy, in Torino, where I start my cardiac surgery. And when I met my first mentor, Professor Morea, at the time, one of the pioneers, let's say, of this type of surgery. And so this was probably the man that inspired, especially for surgery, because he was fond of doing something new, or already always try to explore in something new. And in fact, many of the things I learned on the aortic root was because one day he asked me to study a little more the root when I was a resident, because he wanted to know if the use of stentless valve, how the stentless valve will interact with the base of the aorta, so with the root. So that's why I study I took the time to study old paper from the 70s, 68, where people were using initial evidence using animals to see the movement of the root. So I learned some basic stat at the time, that later on, when I was many years later on, was the probably the reason why I took the idea of change the graft to do aortic root surgery. And probably those information came from this early study, even though the design happened somehow by chance. But also, I think some of the information you put in your head are there, and sooner or later they come out, and somehow helps you in doing something more. Of course, I think that another surgeon that inspired me from that point of view, and this from an international point of view, is certainly Tyrone David, because I met him when I was at the University of Utah doing a research fellowship there on artificial heart. And we were doing implants in cow, in sheep. And one day this young surgeon at the time was on top of the surgery, because he was doing new stuff with the mitral, with the aorta, as you know. So he came, and it was a little bit fascinating by try to invent something, and so that's why when he described the David procedure, it was fascinating, and I read that article many times. It was difficult really to understand. As you remember, even the drawing of that operation were kind of not like the one we can see today with video and colors and stuff. It was completely different. So it was even difficult to really understand. But actually, when I year later, when I developed this graft, I had to do my first reimplantation, and I did the reimplantation with following his article and the step described in his article, because I never saw it before, never in my life live. So I had to do it following So this is something that is it's important. Always looking at what other people have done is also important for young people. That's why now I understand why the question that young people ask to me today, and I know how much my answer can make the difference for them, because I went through the same process before.
It's interesting how the knowledge takes time to spread into the community of surgery and in medicine. So what you say that it was difficult to understand that article wrote in the late 80s now is something that is in the knowledge of almost every cardiac surgeon in the world. Another question about the present and the future. So you've been involved in this research in the aortic root, but for sure it would be interesting to know details about your current research projects. And are you involved in research that can have implication for patients' care in the near future?
Actually, at the moment, of course, we are still focused on our research on the aortic root, because recently we developed a technique just to reconstruct the anatomy, to better describe the reconstruct anatomy of the aortic root. So we use some clip, the clip we normally use to close the smooth vessel as a landmark. So at the end of, let's say, a reimplantation procedure, we put the clip at the bottom of our prosthesis at the top of the commissure, so we could then see it with the CT scan. We could actually reconstruct in 3 planes all the aortic root and see how perfect was our reconstruction from an anatomical point of view. You know, if the anatomy is perfect, also the physiology will work better, and this will benefit the patient in durability, because we really think, like all surgeon and anatomist, that we try to copy what nature has done. At the same time, this ironically, based on my research, is always around that small square centimeter at the center of the heart, because study the interaction between the aortic and the mitral valve. We have now developed a new ring for the mitral valve that is has a saddle shape, but is open on the anterior part, so it allows the root to wedge inside the mitral valve, so we don't lose the interaction that we have between the aortic root and the mitral valve. This, I think, is another step toward in improving in a good anatomical reconstruction and secondarily a good physiology. So you can see sometimes the devil is in details, and a smaller step needs to be done in order to slowly go ahead and improving. At the moment, also, we are studying how this changing the relationship, the interaction between the aorta and the mitral will benefit the intraventricular flow. Because, of course, when you have a good physiology of the mitral valve that is in a good opening, and then you can see rotational flow inside the left ventricle, very similar to the rotational flow you get into the sinus of Valsalva when the flow exits. So vortex are so important into the normal functioning of the heart. So we have vortex inside the ventricle and helps closing even the mitral valve. There we have vortex at the exit of the heart and helps closing also the leaflet of the mitral valve. And also vortex helps opening the leaflet because reduce the turbulence of the flow. So these are things we are now can see it because of 4D flow using magnetic resonance imaging. And this is the next frontier, because by studying the flow, we can make our operation more perfect from a physiological point of view. And this is our field of research now.
Thank you. It's very interesting, your expression regarding reconstruction of anatomy, which is the effort of cardiac surgeons. And it's somehow in conflict with the emerging technologies in which technological devices are used to treat cardiovascular pathology. What is the role of technology, in your opinion, in respect of the changing of treatment in patients with cardiovascular pathology? I think about end of transcatheter devices.
Yes, I know transcatheter device, it's important because it allows us to treat patients that cannot be treated by surgery simply because the stress and the risk of surgery a certain age or in certain pathological condition is very high. Sometimes technology is a simplification of anatomy of reconstruction. Thinking of the TAVI is an excellent transcatheter aortic valve replacement, is an excellent technique, but still we don't do a perfect reconstruction because we live inside all this calcific material that somehow modify the flow inside the aorta, and this may have some consequence, but still is working as well as the surgical prosthesis. But at the same time, for instance, the mitral clip, it is another great advance because allows to non-invasively treat patient from an anatomical point of view is certainly not something you would like to do. And so technology is a simplification toward the functional point of view, but certainly not from anatomical point of view like we learn as a surgeon or an anatomist. So I think it's good to treat those pathologies that cannot be treated by surgery, but can never be reach the same level of quality, let's say quality of a good manual reconstruction, something custom made. When you have a custom made, even the car, when they are custom made, some are more costly and more better. So
the field of cardiovascular surgery is in a period of changing, I think. What do you believe are the most pressing challenges facing cardiovascular surgery today? Do you think that there will be changing?
I understand. The challenge is really to enter also this world that is completely different what we have learned years ago. From one side, you have to enter the minimally invasive approach, so try to do the same things with the same quality, with the less traumatic approach. So something is more difficult for the surgeon. They have to learn to move the hand in a completely different way. So this is one challenge. The second challenge is entering the transcatheter world because we are born to treat cardiovascular disease. So we need to be able also to use this technique. So I think the challenge is double because you have to enter two different worlds, modify the way you do the work we normally have done for many years from a surgical point of view, at the same time learning some endovascular approach, because to be able to choose the best opportunity of treatment for each individual patient depending on the age and the clinical condition and clinical characteristics.
Regarding your role of teacher, you're a professor of cardiac surgery, and you have an extensive experience in dealing with young people. You've been young yourself, so you probably remember the time when you were a resident and looking for your future with maybe worrisome. there is apparently a lack of motivation towards surgery in these days. Young doctors are attracted more by other disciplines. So, would you still suggest young doctors to embrace the cardiovascular surgery career? And what would you suggest to these young colleagues?
Actually, I mean, I don't try ever to convince someone to do this, because is a difficult job, is a long learning curve, is an hard work. So I never try to convince. Even when the young people ask, what do you suggest for me? I rather not to say anything specific. But when I see a lot of interest in some young student in this field, that's why I spend a lot more time when I see the people really have a passion for this thing. So I try to encourage those people where I see a light in their eyes. I don't try to convince someone to do it from scratch. But when I see, and because we need a lot of time. Actually, we should be spending more time with young people that we don't have. I think the problem of today is the lack of time we do, because we have to do work, research, things. So we don't have a lot of time for giving for education, and it is a pity. But when I see the light in the eyes of someone that has a passion of this is like excite me, and I try to push the limit of this type of people, because I know I can get more, and I can get also their own satisfaction.